Well, so I luck out. I get to be the first keynote speaker today. So I'm gonna kind of go in to share some content today. And I want to share my screen. I think I said that I have been a midwife for 20 years, focused exclusively in community-based birth. For those of you that work in the hospital, I'm sure it's easy to understand that doing a birth in someone's home or in a non-technological environment birth center is not the same as a hospital. A hospital gives you so many resources, a button to push, backups to call, resources to come in and help. And that is not the case in the community setting. So it's a very specific education that's required for midwives who can and need to be able to do all the parts of midwifery. So that's been my focus. And I love to do the clinical care. That's very exciting to me. But I also love to do the business side. So I'm very excited to get to share my screen today so that I can show you what I'm looking at. Let's see if I can be successful at this. Okay, so I think this is working. So I'm just taking you here to my website. My website is midwiferywisdom.com, and what I try to help is provide modern success for birth entrepreneurs. I work with a lawyer in the US, so we do legal consults as well. And these are kind of the things that we focus on. So we help midwives and birth entrepreneurs, because of course you can run birth business without being the provider, do actual birth center administration and setup. We talk about starting a practice from the beginning for those new midwives. We do practice startup, business plan creation. If you're looking to get funding, we talk about how to strategize and allow for some funding creation. And I do help nonprofits as well as for-profits. Some midwives or birth entrepreneurs contact me because they're in a period of growth. And so they need to help with business expansion, strategic planning, maybe hiring new staff. We also go through the back office proficiency of running a birth business. There needs to be informed consent documents and contracts for your clients and patients to see and sign. Those have to be standardized and evidence-based. Then there's a really basic piece around office organization and just managing your practice. Running a business involves also running a practice. Those are separate jobs and they're both equally complicated. We also help with electronic health records. There are many parts of the world that haven't quite figured out how to integrate digital charting. So my work helps with that. And then I also love to help midwives or birth entrepreneurs polish their public image and create that balance that they're looking for. So this is like creating your website and copy editing so that what you write attracts the right people. And then all the social media branding, brand development, digital marketing, that's really essential. And then of course, what I'm sort of known for is teaching work-life balance, creating systems and sustainability within your life so that midwifery doesn't burn you out. Relationships in your workplace are also vitally important. And so I really like to share this process as well. And I do sometimes coaching for students in a development, but I also help to coach preceptors develop a student program. Like Leila mentioned in the start of this, we desperately need more midwives the globe over. And one of the best way to create more midwives is to actually take students under your wing and teach them how to do it, to have a direct one-on-one or one-on-two student program. So we help birth centers and practices start up student programs. We do emergency peer review and trauma counseling because let's just face it, this birth stuff is hard. It affects us in many ways. And sometimes you just need to have an experienced mentor to walk you through that. And then we do also partnership mediation and dispute resolution, because working with people in these intense life and death situations can bring up all kinds of things in your co-midwife relationships. And then lastly, I do have kind of a real business arm where we do legal consulting. If you're getting investigated or audited or sued, we help with that legal consulting. We also can help with billing and coding, managing accounts receivable, because you need to get paid. That's very important. And then lastly, all these things need to be held in the document called the policy and procedure document that outlines what you say you're going to do so that your team and in fact yourself can follow through with the policies that you set up. So again, this is all on midwiferywisdom.com under the consulting page. And I really do love to share the skills for success with midwives around the globe. We can tailor it to wherever you live. The next thing I'd like to share is one of the resources that I've developed, which is what I call the Birth Business Club. So the Birth Business Club is it's a group. It's a support group. It's a membership group. It's education. It's a little bit like a school in some ways, all devoted to birth business education, running your business, being an entrepreneur. And I've created something called the Birth Business Club Masterclass. And so I'm just going to tune into that right now and share one little chapter of that so that hopefully you can see kind of what I'm talking about. So the Birth Business Club Masterclass is a 6-week intensive online class that really helps to it helps us excel in birth business. And one of the ways that we do this, it's having a hard time recognizing this device. Of course it is. Let's see. So anyway, lots of people have taken the Birth Business Club, and we do ideal client. We really try to define who your ideal client is, how you create a profitable business. We define strengths and weaknesses, help you connect with your why you're doing this. We talk about the ABCs of birth business, planning for strategic growth. We talk about digital marketing and positioning yourself in the market, how to set your price, how to determine how you relate to your competition. We talk about time management and tech tools. It's really a fun workshop. And I really encourage midwives who are hesitant about putting themselves out there and really doing a good job in birth business. I really encourage the potential to open and take this course. I do have another short course, which is called Start Right Now, and it's about how to actually set up the legality in the US. But my Birth Business Club Masterclass is actually for everyone, anywhere, about how to be successful in business. So there's lots of misconceptions, but I guess one of them that comes out a lot that I was going to just point on today is this idea that we have to be all things. And my biggest advice is you don't have to be all things. Midwives are just known for jumping in, doing what needs to be done, working 24 hours straight, sleepless, skipping meals just to get it done and be there for the people that need them. And this kind of behavior, although valid, and obviously we all know where it comes from, we have a big hearts of service and we want to help people, but it always leads to burnout. And so if I could send away one takeaway in this whole process, it would be how important it is to really take care of yourself. And one of the best ways that we do that is that we hire other experts. So in birth business, although you do need to know how your business operates in general, you do not need to do all the things. So there are other ancillary service providers in all communities around the globe that you can hire to help you run this business. So for instance, you do need to know how your money comes in and goes out, but you can hire a billing manager who actually puts the codes in and bills insurance for the care. You do need to know how your money moves, but you don't need to be the one that actually writes all the checks and balances the books. You can hire a bookkeeper who can manage the accounts payable section of it all. You don't have to answer the phones. That's what receptionists are for. You don't have to figure out how to network your computer with your printer. That's what IT professionals are for, and on and on and on. So my biggest advice is, although you do have to do it all in midwifery, you don't have to do it all in birth business. So research those other amazing people who are experts in their fields, and pay them, or even better, deliver their babies so you can barter some services with them, and really delegate some of the work of running a private midwifery practice, because it's a huge amount of work. This is why around the globe we've seen this conglomeration and homogenization of healthcare. We see these really big corporations forming, big hospital systems, because the administration of healthcare takes almost as much time as the actual providing of the healthcare. And so if you're going to be an independent private practitioner, it makes sense to bring in as much help as you can so that you don't burn out, because frankly, we really need you. We need all of you. We need all of you to be successful and to have your needs met, to not burn out, to be able to enjoy what you do, to go to work with a spring in your step, to continue to serve clients with kindness and gentleness and joy. And frankly, that is really hard to accomplish when you're exhausted and overworked and overwhelmed. So hire those other professionals. That's my number one take-home advice. So one of the other things that always comes up when I do consults with midwives who are struggling is that they don't really understand on the clinical side how also to utilize assistance. So I want to break it down a little bit to begin with. This might be self-evident for some, but if you're beginning or you're new, I always like to say it. When you're running an independent birth business, you actually have 3 hats. And by that, I mean like jobs. So if you're the midwife, so you're the provider, you wear a provider hat. And then you also are running a practice, whether or not you have staff, the policy and procedures you set, the informed consent documents, your call schedule, who you call, who's on call for who, what clients you take, all of that is managing a practice. So you're also a practice manager. And then in order to, be legal in the world and make money and all that, you also have a business. So you're a business owner. In all 3 of those jobs require different responsibilities, different work, different time, all of it is separate. So it's just really important to understand, first of all, how much value you're bringing, how much work it is. Second of all, that you really pay yourself enough, because that's 3 jobs. If we apply it to the very segmented mainstream healthcare world, there's a hospital, there's a doctor's office, and then there's a doctor. You better believe those are at least 3 jobs managing all those parts. So when we take it out of the mainstream hospital system and we apply it to the community-based or the independent midwife process, regardless of where you deliver babies, you actually are filling all 3 of those roles, and that's quite exhausting. So in the business management piece, we hire bookkeepers and IT professionals and all kinds of folks that help us run the business efficiently. And in the practice side, we need to also hire people that help us run the practice more efficiently and with less exhaustion on our part. So one way is obviously a receptionist or someone who's going to answer phones, somebody who manages patient payments and those kinds of things. But also even throughout the day, hopefully you have a medical assistant, a midwifery assistant, maybe a senior student or some person that you're able to delegate a lot of the minutia, the detail, the exhausting content that we have to explore all the time, like filing and faxing and ordering ultrasounds and processing lab work that comes in, and phone calls and all the things that midwifery practice demands that we stay on top of all the time. So if you're a solo midwife in independent practice, one of the most cost-efficient ways to figure out how to get help in the running of your practice is to have a student program. And yes, you add a little work in terms of educating a student and showing things and demonstrating things and slowing down your workflow a little bit so that they can pick up details. But you save yourself time when you teach them parts that they can do. And so what I like to encourage is that we have a reciprocal arrangement. In other words, you are giving them their education and they are giving you the equivalent in work hours to help process things like phone calls and labs and ultrasounds and just office cleanliness and order and all those kinds of things. So if you don't have a regular student program in your region or in your country or in your state, consider starting one. There are newly graduated midwives all over the globe who don't feel ready to be in independent practice and would love to come assist you for a period of 3 to 6 months to better their birth skills, and they can help you run the birth business. There are senior students who haven't graduated yet who would jump at the opportunity to attend more clinic. There's just lots of ways to make this happen. If you can't institute a student program, then there are retired midwives, nurses, and other folks who would love to be paid a small amount in order to help run the front office and even some of the back office of your midwifery practice. So hopefully that makes sense. Leila, I'm going to have you join back in, see if you were fielding any questions while we were going. I wasn't paying attention. Looks like there's some waving and some hellos from our chat group here with the panelists. Did all of that make sense from a perspective in the world where you are with the people that you work with? What parts of birth business would you say are the biggest pain points, or where do you think people are needing help that I didn't cover?
I think the most pinpoint is sometimes the midwives are not that much optimistic in their work in some countries, and sometimes.
What does that word? Can you say that word again?
They are not automated. They are not working by their own decision making. They are not allowed to work independently in some countries, and it is a really painful because a midwife should be independent. Midwife should be legalized and insurance covered or certification. They should provide them. But many countries, they don't have such these regulations, and midwife support is very less.
Right, but for the countries that are, for the people that are running birth business, what do you think they need things other than what I mentioned?
Yeah, they need so much training. They need too much refresh course to attend and have a coach. Most of them are not competent enough to work in the birth sector at all.
Oh, so they need more clinical training is what you're saying.
Yes, they need more, especially our student and junior graduates, right? Yes.
Yeah. Well, Leila, it's really exciting. This is something you and I have talked about trying to create, is some international clinical training. So that would be really fun. But yeah. Well, if anyone has any questions, the Q&A is open. So our audience and our panel members can ask any questions that they have. We will post the links to the websites I mentioned so that people can go find those. Yeah, that's kind of what I wanted to share. Yeah, thanks to whoever's typing. Thank you very much. Back to you. And yeah, that's kind of what I was hoping to share today, is that, like, don't lose hope. There's opportunity in front of us. And I wanted to share a real close-up, but I'm not sure that I'll be able to because the way that this internet works is it wants me to like verify things and you know, because it's through Zoom. Anyway.
Today we are opening digitalized midwife sector for all of the midwife.
Answer is open. Yes, it is. Yes, answer is open. So you can type a question and we can respond for sure.
We have some friends, they are speaking in Arabic or Persian. They have some language problem. They want to ask their question in their own language. They can write. I will translate in English and you can get your response. It's okay. I can do this translation. Anybody?
Perfect.
Welcome.
Thank you for that. What a gift.
Thank you.
All righty. Well, so today we have quite an amazing show. Great. A lot of amazing panelists. And so I was just going to kind of share what to expect today. And then we get to hear from our next speaker here shortly. So our first speaker, starting in just a few minutes, is going to be Irene Garzon, and I'm sure she'll pronounce it better than I am. She is a Spanish midwife who's currently living in UK. I'm sure she has a lot to share. Then at 11:15 UTC, do you want to introduce that keynote speaker, Leila?
Yeah, the next one will be one fantastic lady, Dr. Lucia. And she is basically from UK and now she's in Spain. So we will be after her.
That's so funny. I love that. That's a nice switch. That's a good symmetry there. And then we'll have our first panel discussion. And I know that you know who this is being moderated by. Leila, do you want to introduce that one too?
For moderate for our
panel one discussion.
Yeah, panel one will be Fatemeh Qudsi. She's midwife researcher from Iran. And she's Master of Midwifery Counseling from Iran University.
Okay. Yep, great. Then we have the great pleasure of having you screen your documentary. So that we'll look forward to that so much. Thank you so much for that. Then at 12:30 UTC, we go to Tanny Paxton. She has a master's degree in public health, and she's a community-based and hospital-based midwife in Australia. And then at 1 p.m. UTC, we go to a midwife who's from Iran but practices in the U.S., Victoria. And then at 12:30 will be our second panel discussion. Leila, will you tell us about that one?
Yes. Our second panel discussion will be about pregnancy and body assessment during pregnancy for exercise. This is with Dr. Nilufar. She is the coordinator, Dr. Nilufar Fariba. She is PhD of sport medicine from US and she's midwife from Iran. She has a panel with her co-team, so they will explain about some new studies that they have done in Iran according woman assessments for pregnancy exercise.
Okay, wonderful. Then we're going to go at 2 p.m. to hear from Yuta Rorab. She is a senior midwife, an incredibly experienced independent midwife in Germany. She's had almost a 30-year career in hospitals, homes, birth centers, U.S., Germany, abroad. She's practiced all over. She's an exceptional personality too. We'll be really looking forward to her. At 2:30, we have Norinda Novieti in Indonesia. Very excited to hear her presentation. And then at 1500, we get another keynote presentation with our lovely Leila Mostovi. She has so much to share, including about the project in India that she's been developing. So we'll look forward to that. At 1600, we move, I'm sorry, 1530, we have MA-MCHS. And she is a home birth midwife in the US that has traveled extensively, practiced all over South America. So we'll be excited to hear her reports of care. And then at 1600 is our third panel discussion. And this one I'm so excited to hear. Leila, tell us more about the people you've gathered for that.
Thank you. The coordinator of the panel is Dr. Farzaneh Golbani. She's PhD of Midwifery and she's member of Ministry of Health and WHO representative in Iran. She's author and she's a creator of digital midwifery textbook. She's one of the survived midwife from COVID-19 and she's working in Ministry of the Health in Irani or Persian medicine sector. So she treated herself by Persian medicine sector, and in Iran they are trying to make a new treatment for COVID-19 affected people by Persian medicine. So she will have two topics to talk about. One is about midwives in COVID-19, how they work and how they support the unity and provide people with all facility and services. And then she will talk about Persian medicine in treatment of COVID-19. And we have a short movie with our hypnobirth midwife who's activate in during pandemic and working in this time.
Wow, that is so exciting. I can't wait to hear that one. After that, we go to, will you tell the next one?
Yeah, the next one is Efat from Turkey, some fantastic experienced midwife. She's sitting there, she's saying hi. She's one of our senior consultant midwife with huge experience from different countries working in Kuwait, from Iran and Turkey. And she's one of our lovely professor from Iran. I hope you hear from her because she's a very fantastic, I don't know how to say, brilliant midwife and so lovely, spiritual soul like you.
Oh, that's so wonderful. We can't wait to hear all of these amazing insights. And then at 1700, we go to Amelia Marie, and she is a midwife in Brazil. So we're going to hear about what's happening in Brazil and also her contribution to independent midwifery. Then you go ahead and take the next one, Leila.
Yeah, this next one is Mahbouba from UAE. She's a registered certified midwife and master of management. She's head of one hospital, midwifery head in one hospital in Sharjah, and more than 30 years experience in midwifery.
Okay. Okay, that's awesome. And then at 1800, we're going to round out this amazing day of presentations with midwife Heather Mina. She is a certified nurse midwife who's currently by the travel ban stuck in Ecuador, but she has been trained in the US and she has been grant funded in order to study traditional midwifery. And so that's why she's been in the mountains of Ecuador learning from the very traditional midwives. And it will be very excited to hear her contribution as well. Traditional midwives, of course, before licensure or standardized education, those that just learned from each other are the original independent midwives. So we'll be very happy to end with that conversation. Leila and I, of course, will jump on and finish the day out with a few closing statements, and then we will fall happily into bed. But of course, we are many, many hours outside of UTC and are doing the day backwards. Did you have a nap today, Leila? I did.
Yeah, actually, we are in Ramadan month and we had very hard work. I want just to point out one of our fantastic team coaching in this webinar, Dr. Victoria Karimian. She is our scientific board member and she did huge help and work for us to prepare these panels in Iran. It was not easy because in Iran we have problem with Zoom banding and we have a sanction problem for connecting to this webinar. So she prepared all of the groups and I'm so thankful from her for her presence. She's waving to everybody.